Hello everyone, Dr. Joel Schwartz here. I'm a chiropractic physician and I practice in Monroe Township, New Jersey. Today I'm going to talk to you about hip arthritis. Now, hip arthritis is a very common condition, and with the aging of the baby boomer population, those people who are 50, 60, and 70 years old are going to have to probably have a lot of hip replacement surgeries. That is a very common orthopedic surgery, and it's going to be even more common in the years to come. It's pretty sad because a lot of those surgeries could be prevented if the problem was treated much earlier. If people have their hip mechanics looked at and correct the problem, you probably will avoid a lot of these hip replacement surgeries. So let's take a look at the anatomy of the hip. So let me show you the anatomy of the hip on this anatomical model. This is the thigh bone here, also called the femur. And this is the pelvis. And this bone here is the ilium, there's the ischium, and the pubic bone over here. So the hip socket or the hip joint is actually made between the thigh bone and the pelvis. This is the hip socket right here. Okay, inside that hip socket there's cartilage, and that cartilage tends to wear away with hip arthritis. Now, I want to distinguish for you different types of hip pain in their location, because when you have pain that's due to the actual hip joint, the pain will be located in the groin or down the inside of the thigh. Whereas if you have pain from the sacroiliac joint back here or the lower back joints, you're more commonly going to have pain in the buttock and down the back of the thigh. So that has to be distinguished. Now, why do people get hip osteoarthritis? Well, it's really due to micro-trauma, slow repeated traumas that happen day after day due to how you use your hip and how you use your body in general. Understand that the hip is, all the weight of the body plays out onto the hip joints. So your head, arms, trunk, and abdomen, all that weight comes down into these two hip sockets. So they accept a lot of weight, and then the hips are supported by the feet and the knees and everything below them. So the alignment of the foot, the knee, the hip, the low back, all this is important to how the hip socket works. So I would suggest you take a good look at yourself in a full-length mirror, take a good look at your family and your friends, and you'll notice that all people aren't the same. Some people walk with their feet turned out, some people walk with their feet turned in. Some people have bow legs, some people have knock knees. Some people have one hip that's higher than the other, some people have one shoulder that's higher than the other. All these mechanical differences contribute to strain, and it's one of the key areas of strain in the body is the hip socket. So that's what we have to look at when we examine you. And how do we examine you? When you come into the office, we give you a full medical history. We perform orthopedic tests of your hip. We also perform neurological tests if we need to. We'll take hip x-rays because x-rays will show us if there's arthritis in the hip. Sometimes MRIs are necessary with hip arthritis. Sometimes blood tests are necessary as well. So we do those when they're needed. So let's talk now about treatment of hip osteoarthritis. Hip osteoarthritis can be a difficult or challenging problem to treat depending upon how far along your problem is. So we want to bring together as many good therapies that we have simultaneously to help you. We have two basic ways of treating the problem. We treat the pain, but we also treat the cause of the pain. So let's talk about those two different ways of doing things. Now, when you have arthritis, some of the general things that you learn to take over time are non-steroidal anti-inflammatory drugs like ibuprofen, Advil, naproxen, Aleve, things like this. And these are okay to take. I'm not telling you not to take them. However, they do have pretty serious long-term side effects on your GI tract, your kidney, and your liver if you take them for a long period of time. Other drugs like Celebrex cause clots. And so these whole range of non-steroidal anti-inflammatory drugs have significant side effects. So if you want to take something for pain, you want to think about something that you can take safely for a longer period of time. And in our office, we use many different types of things. We use herbals, we use nutrients, we use a thing called flavocoxid, we use MSM, boswellia, glucosamine, chondroitin, and fatty acids. These are the things that we use to relieve the pain of hip osteoarthritis and also to help regenerate the cartilage. I just want you to know that I'm not telling you what to do with these specifically, because that is a problem that you have to talk to me about specifically. Just listening to a commercial and just taking something because you heard about it on the TV isn't necessarily safe. You have to know how to combine these things and how to use them, and you have to know about interactions with drugs that they might have. So that's important. Now, as far as treating the cause of the pain, this is really the most important thing. We have to remove that strain on your hip socket so the process of osteoarthritis doesn't continue to progress. We have to balance all the muscles in the joints in your entire lower extremity, from your foot, through your knee, through your hip, up into your lower back, because that whole thing works together. So we give you therapeutic exercises that are very specific to your actual alignment problem. We also might use heel lifts, orthotics, or insoles in your shoes if we think that your feet are involved. We use modalities like ice, heat, and electrical stim to reduce the pain in preparation for doing the exercises that we give you. And sometimes we use kinesiology tape, which you might have seen athletes wear. They use it to reduce pain, but also to help with reducing the stress on the hip. And we also use hip mobilization. These are techniques where we actually get in there and stretch your hip joint socket to get more mobility in it. So all these techniques work together to get the best result for you. Just keep in mind that hip osteoarthritis can be a difficult problem to treat, and you really need to dedicate yourself to following the treatment plan that we give you. Okay, once you're starting to feel better, you need to continue to do the exercises that we show you. Okay, so this problem can take several weeks for you to feel better. It can take several months, but once you start to feel better, you want to stay feeling better, so you need to stay with it. If you stay with it, it's very possible that you can fix your problem, not have to have surgery, or at least delay surgery. So it's definitely worth a try doing this. Also keep in mind that earlier in your life is when all these types of problems happen. So even going back to children, children exercise, they move around. If they're not doing the right exercises, they're actually doing things that are hurting their hips. So it's a good idea to have your kids evaluated and teenagers evaluated so that they can learn to move correctly and have their hips balanced and prevent the problems like hip osteoarthritis. All musculoskeletal injuries start early in life. They start due to the way we move and how our bodies are balanced. So if you have any questions about the methods that I presented today or would like to make an appointment, please see our contact information that follows directly after this video. Thanks for watching.